Hello, everyone, and thank you for joining Defeat Duchenne Canada and Children's Hospital London Health Sciences for another in our 2023 webinar series, with today's session focusing on shared decision-making. My name is Rick Moss, and I'm the National Director for Strategic Partnerships at Defeat Duchenne Canada. For those of you who might be new to our organization, John and Jessie Davidson founded Jessie's Journey in 1995 to lead research, advocacy, and support in the fight to defeat Duchenne muscular dystrophy. Since then, we've united families across Canada, raised awareness, and funded almost 17 million in research projects around the world. And we're known as Defeat Duchenne Canada. Why are we here and what do we do? Well, our mission and vision, Defeat Duchenne Canada is the country's only national organization dedicated to ending Duchenne muscular dystrophy. We provide leadership and research, advocacy, and support to ensure our boys can live long and active lives. We provide education and support through a number of things like our webinars, also through our family forums and other events throughout the year. We advocate on behalf of families across Canada for all rare diseases, but especially for Duchenne. And that is something we're going to be doing more on tomorrow that I'll talk to you about at the end of this particular webinar. And we are still funding research, as I mentioned, nearly $17 million in our history worldwide to the best and leading research in Duchenne muscular dystrophy and neuromuscular diseases. I also want to thank our sponsors for making these webinars and our other educational activities possible. To PTC, our platinum sponsor, to Edgewise Therapeutics, also to Regenex Bio, Battelle Pharmaco, Pfizer, Avidity Biosciences, and to Roche. And I want to thank everyone for participating in that particular partnership package that we have that allows us to bring you programs such as this. It's my pleasure now to introduce Bonnie Wooten. Bonnie is a registered nurse at London Health Sciences Centre. Bonnie is also the shared decision-making project lead and decision coach at Children's Hospital, London Health Sciences Centre. Bonnie has been passionate and dedicated to this particular program. It's been incredibly successful and welcomed by so many families who we'll hear from this afternoon. And so now it's my pleasure to turn things over to Bonnie Wooten.
I've already been introduced as the shared decision-making consultant and decision coach. Dr. Craig Campbell is the lead physician and the person who was responsible for bringing shared decision-making to children. So he is not with us this evening. He is away, but I know that he appreciates everything that we're doing here and welcomes you as well. Our advisory committee, I wanted to introduce you to our advisory committee. They're made up of family advisors, youth advisors, a social worker. We have a community rep advisor, muscular dystrophy rep advisor, and we have some pediatricians. And they're very involved in the work that we do. And to enter shared decision making is the focus and the focal point of patient-centered care. So our agenda for the next 20 minutes or 25 minutes is about to share with you what shared decision making is, why should we commit to a shared decision making environment, and how might we make decisions. And tonight or this afternoon, we also have a set of parents who were involved, Pete and Sarah, who are involved with receiving a consult, were referred to me, and they're going to share their experiences on shared decision making, what working with a coach is about, how they got referred, what their experience was, and it will help those of you who are wondering, because I'm going to talk with you a little bit about the background and the evidence and how you get referred, but Sarah and Pete can tell you about their experience firsthand. So what is shared decision making? This is really a kind of a formal definition, but it is a structured approach. It's a structured approach of working with the family and the physician or the healthcare team about and collaborating on a medical decision-making or a decisional situation that the families have. And it's a process that takes into account the best evidence and the patient values. That's a very formalized kind of decision-making definition, but it is a structured approach, very focused on decision-making. Well, there it goes. Okay. It is, we're made up of an environment of various cultures. We're an awareness, we have a great deal of awareness going on. We're committed to careful and kind care in our environment. We're involved with a number of partnerships. One is Defeat Duchenne Canada and a number of stakeholders. Our environment is also made up of decision aids, which I'll talk to you about, decision coaching, and a decision education program, which is what we're doing tonight or this afternoon. Keep saying tonight because it's kind of dark here with the snow and the sun has gone down. So, first of all, what are decision aids? They are interventions that are designed to help people make specific choices. And they are something that I keep in our toolbox. We have a website that I encourage everyone to go to, and we can put that on in the chat box. And in that toolbox, we have decision aids, and they are interventions that are designed and tailored to each decisional situation. They provide information on the options, the pros and the cons, the risks, the benefits of a particular recommendation and decision that your healthcare team has made to you as a family. And these are all used in addition to counseling. So decision aids are an adjunct to what you already receive when you're being counseled by the medical team. And they come in different formats. They come in print. They can be on video or DVD. They can be online, computer-based. Pediatrics doesn't have a great deal of DVDs and videos. We're building that information, but the adult population has more videos which are very good for families to actually see and experience more specifically some of the recommendations that are made to them. And of course, online computer based is where we go to find our research and our information that's appropriate and tailored to meet the family's needs. I always encourage families to stay off Dr. Google, but I do know that it is a place that you go when you're looking for something, when you're looking for information. This is a decision aid. It is a type of decision aid. It's very small to read, but it does compare. It's used in some areas. We don't use this type of aid, but it is used in some areas to compare the risks, to show families what the risks are with a particular disease or uh, a piece of or a recommendation. One is about measles, one is about vaccines. This is a decision aid that I use with all the families. Again, it's in our toolbox, and it's very difficult to read because it's small. But what it does is it weighs the pros and cons. You would have choices of options down the left-hand corner. This one's specifically about diabetes and whether to use what type of device to use to measure your sugar. And it tells about the pros and cons, the importance of it, and then it looks at supports. Do you have enough knowledge? Do you have enough support to make a decision? And how do you value that decision? And that's what we're going to talk about with Sarah and Pete. And I'll bring up the actual decision aid so we can work through when this introduce you to this particular tool. And in terms of shared decision making and coaching, a coach can come from within the healthcare team or it can come from outside the healthcare team. And it's children's my role specifically is I'm outside the circle of care. So I'm the one who guides and supports you through a systematic approach to decision making. And it is my job to make sure that you as family understand the recommendations that are given to you, that they're in language that makes sense, that are clear. It's also my job to make sure that the risks and benefits are profiled in an accurate manner so that when you're making decisions, you have risks and benefits that make sense to you, that are supported by the healthcare team, and also the decision aids, the information that we have about that disease. So I need to be able to um, make sure that you know that I understand all aspects around these issues so that I can bring these tools to the decisional situation that you have. Um, the decision coach outside the circle of care is remains unbiased and objective. When you're as part of the circle of care, you may, as family, think that person has maybe a tainted view, or they don't come to you in an unbiased manner because they've been part of the discussion and the decision making. Where at children's, the reason we have the decision coach outside circle of care so that the decision coach can remain unbiased and objective and come to you in that way so that you don't think that that person's already made a decision on your part and guides you that way. The decision coach doesn't make the decisions for you. They guide you through the process, and they try to assist the families to come overcome their obstacles to decision making, give them some tips on what to think about, how they might set themselves if they're struggling with how do you present your preferred decision to the healthcare team. We talk a little bit about what would be the best way to present that, but it is up to the family once they get to a preferred decision to take that decision back to the healthcare team and the person who made the recommendation. And so what the coach does is what I do is help you advocate and provide a clear message to the healthcare team so there's no confusion. So in terms of decision coaching, there are difficult and complex decisions, and we know we live in a world where complexity has grown in many forms, and options for families have increased tremendously. On the left-hand side here, you see the various types of complex decisions. There has clinical trial participation, which Sarah and Pete and their son have just completed. G-tube is another example, gender assignment, epilepsy surgery. I'm heavily involved in that. But we also know that there are decisions that create stress. They're not always medically. Um, some of the medical decisions are very clear, and the healthcare team has explained the information very well. However, there are decisions that create stress in making those just complex decisions. Could be the family has disagreement in the care, faith or cultural aspects may cause stress and conflict, financial impact, anxiety. There's also the helping separated parents work together. That is an area that has grown in its complexity. Decision making is stressful enough for parents in general, but it can become very complicated with separated parents who share decision making legally but disagree on a course of treatment due to a lack of mutual trust and conflicting opinions. Having a neutral third party through shared decision making program offers a critical intervention to objectively examine the options and potential risks and benefits of the different decisions. So that is another whole area. Um, for shared decision making, the coaching is done on a one-on-one consult basis. Anyone can refer. You as parents can do a self-referral. We just look for you to have a pediatrician or a family doctor when you're doing it, because when I do my reports, the copy of that goes back to either your pediatrician or your family doctor or both. It's open to all pediatric services. The consults are done throughout Ontario, and I've had some across Canada, and they're done through WebEx, which is a very private, secure line. And they can occur at any time through through the week. We do them pretty well most of the hours. It's not like a 9 to 5 option for you or consulting service. I do consults into the late evening and sometimes on weekends when families, that's the only time that they have to give. And so I do occasionally, I do some on weekends. I do document the information, the communication. So if you referred yourself, I do message out to all your, and I let them, your medical team, whether that's your pediatrician or your family doctor or both, letting them know that you have been referred or that you've referred yourself about this particular decisional situation. I ask them if they'd like to contribute to the discussion in any way from their time working with you. And sometimes people send information and said, you know, give me decisional aids that they've um, um, worked with you and your child through the discussions and the discussions that you've had on the recommendations, because I don't go into a consult without knowing what the physician has said to the family. I don't come to you making up my own recommendations and my own options and my own decision aids. I only talk about the decision aids and the recommendations that are tailored to you and your child's issues. And so that everything is is in the open, and there's nothing that you wouldn't have heard. There wouldn't be anything new that you would have heard in terms of the recommendation. The other thing that I always encourage families to do, if you have a child that's of an age and neurologically able to be part of the discussion, I encourage you to make them to have them join us in the consult. The child's viewpoint and how they perceive the decision and what they have to say about it is very key to them being taking responsibility for their care. So why should we use shared decision making? So there has been some recent guidelines that this was, I say recent 2018, we're in 2023, but there was quite a big, there was quite a bit of media around cancer screening. And I do know they use shared decision making in the cancer clinics and also with ADHD. And we recently collaborated with the London organization on ADHD to do shared decision making webinar with them. And we are now partners with them for ongoing work that we're going to do together, especially with the schools, especially with families who are struggling because ADHD has implications to making a number of decisions. And so I don't know how many of you are familiar with Cochrane reviews, but they take quite a bit of time to do. The last one here that we have is 2017, but they all said something very similar from the patient perspective. They all agreed that it increased the parents' knowledge. There was more accurate risk perceptions. There was a greater number of decisions consistent with the patient's values. Really important. Your values are very key. You may go through the risks and the benefits and you look at the pros and cons, but how you value that option is very key and will lead you to an appropriate preferred decision. Reduced level of decisional conflict for the patients, and fewer patients remaining undecided. For healthcare practitioners, it was better communication with the team. And it was not time consuming. There has been research done because there are some teams that feel it takes up more time, but really it doesn't take any additional time at all. For the healthcare system, these are probably more reflective of from the adult side, but more cost effective, may improve overdiagnosis and overtreatment. Many patients actually choose less invasive and less costly actions with shared decision making, and it appears to reduce practice variations. You get overwhelmed and you get several people telling you here's what they would recommend. So the practice variations with shared decision making are reduced. and it can alleviate differences in decision making for the lower socioeconomic group. This is I'm not going to spend a lot of time on this, but this is around evidence in pediatrics. It's a systematic review. It was done by Wyatt in 2015, and there were 61 studies found. 54 were unique to shared decision-making interventions, and they did a meta-analysis for 15 of the studies, all showing that there was improved um, um, the evidence showed that there was improved knowledge and improved satisfaction when they did when they had a decision coach and went into shared decision making, use shared decision making. And how do we make medical decisions? So this would be just kind of a cartoon to let you know that we all experience that a group of trying to decide what's best for us, physician trying to uh, listen to the advice. We want them to listen to the advice from you as the patients and your families, and also for patient engagement. Um, this is a cartoon about the lollipop, giving it to the patient. It's just really to show you what happens when you're in physicians' offices sometimes. We're all experience this in decision making. We have family commitments, we have school commitments, we have home commitments that are going on. The physician is very busy when you call. You may experience this in an office when you enter. It's very, we're all familiar with what happens in a busy healthcare environment. Um, and we know that as a healthcare provider, there can be healthcare providers that have a paternalistic view. They flood you with knowledge. They drift away from the evidence. They're very busy and they tend not to be as engaged. And then the patient who's overwhelmed um, gives up control, relies on the individual stories and doesn't want to be a burden and becomes kind of stubborn. That kind of happens in an dyad of working together. In this one was very interesting. It was a study that showed that only 44% of patients realized they had a choice from an emergency room study. And you would think that most times in an emergency room, there isn't really time for shared decision making. It's an emergency, so you would expect that that decision would go very quickly. But half of the clinical encounters have suboptimal decision making behaviors. 80% were happy with the decisions, but that leaves 20% that were unsatisfied. And current healthcare system does not facilitate shared decision making. So these are all studies that were done around shared decision making and encounters that were documented. In the clinical state and circumstances, we have decision making in the middle, but we have patients' preferences and actions, and we have research and the evidence here that comes together to help make the shared decision making, helps to make the preferred decision. And this one is kind of cute, is you have to learn about thousands of diseases, but I only have to focus on fixing what's wrong with me. Now, which one of us do you think is the expert? And I always let the parents know that they hold the PhD when it comes to their kids and what they know best about their children. And so you are the smartest people when it comes to caring for your children. And when you think about committing to shared decision making, we commit to careful and kind care. There's an investment in unhurried and undistracted conversations. We take our time with shared decision making. It's not a one on and one off. It's not 30 minutes. It could be an hour. It could be 2 hours. Could be more than one consult. And decisions, we work with families. The decisions needs to fit that person. We need to try to distance ourselves from a healthcare system that constantly cuts the service find efficiencies and prototypes everything, and stop information overload. Those of you who are families who have children that are in that position, you know that you get a great deal of information and it's hard to separate everything. And this is an interesting quote from a physician. He said, shared decision making can only be reached if doctors listen very carefully to what parents are saying, but also to what they are not saying, but trying hard to communicate. Sometimes they prefer not to discuss things they want for their child or decisions they endorse, but do not want to verbally affirm. So, and that's if Dr. Campbell was here, he would talk about that. He says that he can be guilty of that himself. And sometimes they just prefer not to discuss things they want and decisions they endorse, but do not want to verbally affirm. Sometimes that happens. And so I want to, at this point, just talk a little bit about the parent testimonials from Sarah and Peter, and have a discussion with those of you who are here, and a discussion with the parents who explored shared decision making, their preferences and their experiences, insight into the parents' experiences with medical complexities and chronic diseases. And Sarah and Peter have that experience. And also it's a collaborative communication process to reach treatment plans and preferred decisions. So I just wonder if, first of all, to check on, are there any questions from anyone before before we ask Peter and Sarah to share their experience of what it was like to work with a decision coach?
If anyone has questions, just unmute and ask away, or put them in the chat if you'd like.
Okay, Sarah and Peter, do you want to talk a little bit about your experience? And we have some parents here that might want to join in the chat. Parents, you don't have to identify yourself in person or put your camera on, but we encourage you to ask questions of Sarah and Peter.
Yeah, so we've had a few decisions that we reached out for this shared decision-making process. We we were referred by our social worker, Rhonda. That's how we got involved or how we became aware of it. Before that, it felt like, everything was just on your shoulders. You're left there to figure it all out and kind of go back and forth with the doctors and specialists and stuff like that. So once we heard about this, it was like a whole new side of it, a whole new way of looking at it. And yeah, it was definitely a lot easier to approach it objectively versus, you're dealing with life, day-to-day things, doctor's visits. And like Bonnie mentioned earlier, you can always go on Google to get your information, but you're never quite sure how accurate it is, how much does it apply to your specific situation. And this shared decision-making just kind of hones it all back down narrows it in to your specific situation. And it's all fact-based, like it's all factual. There's no, it takes away a lot of the uncertainties of it all.
And I also think on my side of things, if I were to kind of clarify why I felt like it was important for me, I tend to, as the parent, I think that a lot of you're really emotionally invested, right? So I think a lot of the times that can kind of blur certain decisions, and you can't really think very clearly. You're seeing your child and you don't really want to mess anything up, or because there's that emotional pull, you don't want to make the wrong decision. So I know for me it was definitely a lot easier to go down this route of kind of having a very direct, very clarified answer to a lot of our questions that we had. So definitely. But yeah, if you want, we can kind of break down exactly what our topics were. I guess that's
For
totally,
context.
yeah, for context. So one of the things that we had was, so our son has Duchenne, and at the beginning, when you're first diagnosed, you're recommended by your specialist, by your neuromuscular specialist, to go on steroids. And we have been on steroids. Michael, our son Michael, has been on steroids for 6 years now. And we started noticing that there were some side effects that we weren't entirely happy with. And so we kind of wanted to know what were our other options out there. And we did go over, I think there were 2 options that we were kind of talking about, was either switching a steroid or potentially even coming off of steroids altogether. And our shared decision reach was to switch to a different steroid for now. One that had a lot less side effects, one that families in our clinic are using quite often by the sounds of things. They're all just kind of using that one. And yeah, it was very simple to kind of reach that decision of, I guess, working for our best interest and what worked for our family, and minimizing some of the side effects. Yeah, because I think that can be a really big one with any kind of clinical intervention. There's always going to be some kind of a side effect that comes along with that. So reaching that decision was pretty easy, working through Bonnie and doing shared decision making. So another one that we had was
So our son just finished a clinical trial. We've been in it for about 3 years now, and we were given the option to continue on with the dosing. It was a bit of a turning point. The information was given to us a little last minute. We weren't aware that we had the option to continue dosing until about 2-3 weeks before the end of it. And so here we were thinking, this is the end. Good for us. It's been 3 years. Great. And then you get this new information just dumped on your lap, and now it's time to make a decision.
reevaluating everything that we knew.
Yeah. So now it's new information, and you're reevaluating, and you're kind of trying to stay on track, but there's so much kind of at stake, because there's a lot of, like Sarah said, a lot of emotional pull with the idea that, oh, we thought we were done, and now there's the possibility to continue. And what are the benefits? What are the pros? What are the cons? And it does all come down pretty quickly on you. And going through the shared decision making, it lays it out, it simplifies it, and mainstreams it, especially with the weight of the questions and the pros and the cons. Like, it really starts to break it down to the point where you yourself realize what is actually more important or less important, and what is the deciding factors that maybe are underlying even to yourself when you're all kind of caught up in the new information and stuff. So
Sorry, we have our children around and
That's okay.
are needing us from time to time, but yeah, I think what it comes down to is taking the emotional side of things out of it, and just kind of seeing like the data and the science behind a lot of the questions that we had. And I know another thing that was really important to me was earlier when Bonnie was kind of going through the slides and explaining how the process works. She's kind of like, well, decision making, it's not like they do kind of work with your doctor, but it's not like they're working for the doctor, if that kind of makes sense. So it's like, it's separate, and that kind of helps, because earlier, Bonnie was kind of explaining that a lot of the times you can kind of get into this wondering if they've already came in with this preconceived notion of this is the way that you should go, or that's the way that you should go. And yeah, so that was really helpful, knowing that it was like an individual organization, I guess you would almost call it.
It's 100% unbiased,
Yeah.
completely objective. It really, I'm not sure how to even describe it.
It just simplified it, I would say. Mm-hmm. And it made it feel like it wasn't set up, if that would almost be a better term. So
Sarah and Pete, talk a little bit about, I know you shared with me, talk a little bit about what first entered your mind when you heard about shared decision making and being referred to a coach?
Yeah, well, we were talking about this in a different, actually our last shared decision meeting
All
that we
right.
had with Bonnie. And we were just kind of talking about it with her. And one of the first things that came through my head was, well, you hear shared decision making and you think, oh no, now we're going to lose all control over, medical decisions for our child, right? Like, I don't know why, but that's the misconception that you think. Maybe it's the way that it's said, maybe it's the wording, I don't know, but yeah, maybe that's something to reconsider in the future. But
Really
yeah,
good points. Yeah.
yeah, but for me it was, yeah, you hear it and you're thinking, oh no, now I'm going to lose control over, over my child and being able to make decisions for them. But that wasn't at all the case. But yeah, that was definitely my first thought, wasn't sure how this was going to go. Yeah.
Do we have any questions from anyone who's joining us? Can be anyone. Rick, Perry.
Bonnie, I've got one.
Yeah.
Sarah and Peter, thanks for sharing this. This is great. And I can only imagine the position that you're in and all that you're dealing with and how this could be helpful. Did you find that not knowing this third party option was really better than going to somebody that you might know or be familiar with? Did you find you got a totally sort of neutral and unbiased type of opportunity? I know you touched on this earlier, but the fact that you don't necessarily know who you're dealing with when you go in to talk to Bonnie. If we get somebody from North Bay, somebody's contacting her from Sudbury or Windsor. I mean, this is the kind of thing that sometimes people feel more comfortable with somebody they know. But in this case, did you know Bonnie before, or was she new to you?
She was completely new to us and new to the entire Duchenne experience.
Okay.
Up until that point, it was, you'd speak with your neuromuscular specialist and
Social workers,
and you're dumped on with the information, and you're kind of scrambling. And sometimes those clinic visits or the phone calls and emails, you get inundated with information and you get lost. And to meet Bonnie, like we never heard of the term, we never heard of shared decision making, period. But that first meeting, it was really actually like reassuring to know just how unbiased and how open-ended it was.
I think to help answer the question, I actually did feel more comfortable not knowing that Bonnie was part of the care and part of the, our original team. I don't know why, but that definitely did make it more comfortable. And I think it's just because you don't get that almost I don't know how you would kind of describe it, but it's almost like, yeah, you'll never have to actually worry that everyone's working behind the scenes together and not really including you or letting you know about it. Yeah. So yeah, if that kind of answers that.
Well, it does. And I also am curious, though, if you understandably, I think, and this isn't a criticism, we get the medical opinion from so many different sources, and it is the medical opinion, right? And so I think, it's hard sometimes maybe for families to think outside that box, but important. Bonnie, I wouldn't mind your thoughts on this too, to just get a different, not that anything is wrong with that, but just a different perspective. Or just go up and take 1,000-foot look at what's happening.
So just clarify what it is again that you're specifically.
Well, just that you're the opportunity to move out of the just this purely medical opinions, right. That right. world, which, as I say, I don't mean critically. It's just that right. That's what they are, whether it's a clinician or it's a researcher, it's a psychology. They're all, there's all this line of things all for good reason. But to
Right.
step out of that and get a neutral and not necessarily scientific or a medical opinion.
Right. I think for a decision coach, it's fairly, in my mind, seems straightforward for me. The decision or the recommendation's already been made by the medical team, right? The information has been given to the family.
Mhm.
They already have that. So that's not what I'm there for. I'm there to help facilitate, break that down. I look at making sure they understand what that recommendation meant in language, because sometimes it can be in language that they
Mm.
just really don't get,
Mhm.
and make sure that the risks and benefits are profiled accurately. So that's probably um, my role in terms of the medical team, making sure that I'm supporting them, but also supporting the family, because the intent is to bring the two parties together,
Mhm. Mhm.
right? Bring the family and the medical team together, so that everybody understands what the other is trying to recommend. And having the parents go through the tool that I'm going to show on the screen. I'm going to have Kate bring it up soon, so that um, takes the element, as Sarah was talking about it, takes the, I think it was Sarah or Peter, emotion away from it. It focuses specifically on the
Right.
decision making and the options, and doesn't interfere. We don't talk about the physicians and what they recommend. We don't talk about what the medical team said. We talk about what they're faced with as a family in terms of deciding, and it's up to all of us, myself, to give them all the information and knowledge that they need to have if they don't already have it from the team. That's the team's job, but my team is to break it down. My job is to break it down and make some sense out of it, and for the parents to feel comfortable um, on the decision making, on the decisions that they're making. And um, so then, in the end, of course, we come back and the family draws them back in. But I don't focus on, I only focus on the recommendation. And so I don't focus on the physician and the medical team. The focus is on the physician, on the
Right. Right.
parents and the child.
Thank you. And thanks, Sarah. And also Peter.
That isn't the, there's another tool here I want to bring up. No, I attached it. It was a separate one, Kate. Um, let me see if I can get it to work. No, I don't think I can. It's the tool. I don't know if you have it, Kate, or not.
Yeah, I do. I'm just bringing it up. One sec.
Okay, thanks. Great. I don't know if that quite answered your question or not, Rick, but if that's what you were looking for.
Yeah, absolutely. Absolutely. Yeah. I just think it's
You
gives-
separate the two, right?
For
When
sure,
you go
yeah.
into the coaching, well,
Yeah.
they're there for the family. Can you make it larger, Kate? Can you make it larger on the screen so people can read it a little better? Can people see that, read that? This is the
Yep.
tool
This looks
that
good.
I use, and I know in our last discussion with Sarah and Peter, I did send them the tool that I completed from the work that we did so far. But it's, what decision do you make? There's something written in this one. This was from another session that we did. But you can see, if you just look at the headings. What do you need? When do you need to make a choice? So we always talk about that. How far along are you about making that choice? Have you thought about it? Are you still thinking about it? Are you close to making a decision, or have you made a choice already? It's good to know that going into the discussion. And then you see it's about the knowledge that the family has how they value that information, how certain are they that this is the right decision for them, because they don't want regrets. And that's what Sarah and Peter are looking at right now. They have a decision to make, and we're working on that together, but they don't want any regrets for as parents. And then as you go down here, you can see observation. This is just a sample. On option 1, motivation to recovery first. This was from another session I did, and really in mental health. But the option 1 would be as the first discussion that the first referral that Peter and Sarah and I had. The option was, to continue on the steroid they had. Option 2 is to transfer to something, to transition to a different steroid. Or option 3 could be do nothing. And so option 3 is never a do nothing for the family, but it is an option. And I always try to include it. And then they go through choosing their reasons for choosing this option. This is all the option, the strengths. And then there is a little grading tool here of 5 stars. And Sarah and Peter, for example, were asked to, how did they value each of those, the pros or the advantages to choosing this option. And then on the other side, they go through the same thing, opposite. Well, what were the reasons that you would avoid this? And then they rate those again. And by the time when you work it down to the bottom, when you look at the ratings and where the family came, sometimes they're surprised themselves. Well, I rated this one really high. I guess I really don't want option 1. I guess I really want option 2. But it's important to note that even though they may have rated and starred option 1 higher than option 2, it's how they value that. If they value option 2 more than they value option 1, even though the rating was higher, that's their preferred decision. And then as you go through here, again, it's about their knowledge. Do they have enough knowledge? In our second intervention with my second intervention with Sarah and Peter, we didn't have all the knowledge we needed. So we had to gather up a few more pieces of information, and then we'll have to look at the values and the support. Who else needs to be involved in the decision making? Are their family, are their friends, are their in-laws, or the grandparents? Is there someone else that needs to be involved besides the child, if the child's neurologically able to do that? And then this just talks to you about what the values are and checking off. Do they need to talk to other people that have done the same thing? Would that be helpful to talk to other set of parents, another child? What else matters to them? What what are the benefits from the other family? So what did they experience? And then the support, discuss your options with the trusted person. And Sarah and Peter are the primary decision makers for their family. So they didn't really have other people they needed to go and engage in the decision making. But there are people that have extended families and need to have a discussion with them. Thanks, Kate. Are there any questions on this tool from anyone who's listening? And it's a fairly simple and non-intimidating. It's not an intimidating tool at all. But it really helps too, because sometimes it's really good to have both parents together in a session, because sometimes you all get busy with each other. You get busy with your life, with school, with home, with work, and you think you're communicating with one another. When you use this tool and you get the family together, there are times when I have experienced where families will say, I didn't know you felt that way. I didn't hear you say that before. This is the first time I've heard you say that. And that's why we try to get them together, not to do them separately, especially in those families who are not living in the same household. We tried to get the child there because maybe the child hasn't felt comfortable saying what they wanted to say until you ask them one of these questions. And then then their feelings and what's happening with them come out, and it has an impact on the parents and what decisions they're making. But it's a really great way to do it. And I do all the consults by remote so that we can do them in the comfort of your own home. It's when you have the time, so it's not interfering with your dinner and your family plans and your family time, but it's time that it's appropriate for you, so that you can all be your attention can be given to the process.
Yeah, I would also agree. And you kind of touched on if you could involve the child. And that was kind of our turning point a little bit too with our last decision of continuing
Yes.
on the medical trial drug. It was like we had spent some time, me and my husband and Bonnie, having the meeting and talking about all these options. And then we decided to get our son involved. And, he just kind of rolls in and he's like, honestly, I don't really want to keep going. And we were all just like, okay, like that kind of really brought things into a different decision, and kind of clarified a different direction.
And you wanted him to be part of your decision making, didn't you?
Absolutely.
You wanted him to be part of that.
Yeah, it's always been really important for us to have him as part of his care. At the beginning when he was diagnosed at almost 6 years old, it was something that I wanted to make sure that he would know everything that's going on, that he was a part of everything that's going on. I guess I do fear a lot of regrets and stuff like that. I did mention that earlier, and I never wanted to look back later and have him say, like, why didn't you explain these things to me? Why wasn't I a part of this? So shared decision making was also really beneficial in that area of kind of pulling our son out of his comfort zone too a little and asking him some tough questions that he was actually very able to answer. Like he did phenomenal. So yeah, just kind of getting
He was great.
involved. Yeah, getting everyone involved was definitely the right option there. So yeah, we really appreciated that. But with our second, I guess if I were to touch on a little bit more with our second decision, it is still ongoing. It's not something that you have to decide right then and there. You have to come up with it in one meeting or one session together. But yeah, it's an ongoing thing that we're still considering all of our options. We're still going over everything as a team, as our family, so yeah, it's not something that you have to just quickly get to a conclusion. I think
Right.
Bonnie said option 3 was do nothing. There's always that option where in the end, you're just like, you know what? We don't know what we're doing yet. We haven't decided anything yet. And that's also an option. Do nothing. So yeah, it's not like you have to come to a conclusion either.
We have a question in the chat, Bonnie and Sarah and Peter. The comment is, thank you to the family for sharing the story. Is there training required to provide this shared decision-making for families is the first part of the question. And does the family believe that the skills they've learned would improve their confidence in decision-making going forward?
Is there training like for a person to become a coach? Is that the question?
I'm not sure. We can ask the person submitting it for clarification if you want. It says, is there training required to provide this shared decision making for families?
Yes, this would be Bonnie's training.
Aware of it?
Yes, you do have to have a strong background in the family dynamics, and there is some training for the decision coach with people who are experts in that field. And my background happens to be quite broad and involved with family dynamics. So I came with much of the skill set that was needed for the job and or for the position and to carry this out. And then, of course, as you working together with Dr. Campbell, who had some a good experience as well and was a good support and advocate for me. I also worked closely with another coach who we worked through various scenarios, and I got a better understanding of the protocol and the process. And I also had to do There's a lot of research. You have to do a lot of reading about shared decision making to make sure that you understand and that you believe in it and that you trust that the research that was done, so that you come to the table and come to the families well prepared. What was the second part of the question?
It was, does the family believe that the skills they've learned
Okay.
would improve their confidence in decision-making going forward?
I would say absolutely, because, you know, it got us coming back the second time for
Yes.
another different question. So yeah, it really did. It was a very helpful tool for us to have. And if I were to be honest, I'm not sure that we would have came to the best decision had we just done it on our own between our own family. Yeah.
Very good.
I don't know if that answers. I hope
Did-
so, but
Did you use decision-making in the decision for the clinical trial?
No.
no.
That was 3 years ago, I think you said, or so.
Yeah.
So, yeah.
Yeah.
But going forward, I mean, should
Mhm.
that situation come up again, would you?
Oh, absolutely.
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 Any big decisions, I would be definitely going through a decision coach. And, you know, even if it's something as simple as in the very beginning, when we were first contemplating going on a different steroid, we came into shared decision, into that meeting 80% of the way already deciding that we were in fact going to switch. So it was kind of just like that last little bit that we weren't sure about. That helped to just really narrow that down and pinpoint to what we had really wanted to do.
But like, if I may, like even at that, so we came in at 80%, what we thought we were sure of ourselves. There's still, the confidence isn't as high as we thought we had the decision. So once we had that first initial consultation, we came out of it and we were like
100%.
super confident.
Yeah.
The decision was still about 80%, but the confidence behind that 80%, 100%. Like we were, now we know where we are, we know where we stand, we have the information, and let's go. Like it was.
Yeah, our first decision was very fast. I think it was because we were already 80% of the way ourselves, but yeah, it really just clarified that experience for us very quickly.
Thank you.
I think, Rick, that's a good question about clinical trials. It's kind of a well-kept secret about shared decision making, right? But we think it should be used in clinical trials when people are trying to decide even which clinical trials should I go for? When should I pull out? When should I not pull out? Should I continue? And they can be simple questions, it might not be really related to that particular trial, but it could be, maybe there's some interesting, there could be some conflicts within the family about what to do. And if the child is able to be involved, involving that child as well.
Yeah, because the breadth and depth of a commitment to a clinical trial is huge.
Yes.
I mean, you
huge.
could be hundreds of miles away. And I mean, just a host of things that families are going to have to face and grapple with. So that's good. Thank you.
And because, Sarah and Peter are a good example of that, because they put 3 years of solid commitment into this clinical trial and now are into another phase of decision making. Because do they continue that commitment, or do they say, we're done?
Yeah. And I think part of that hard decision was the fact that we thought we were done, right? Like we were like, we were ready to celebrate, we were planning a trip for the rest of the year sometime. And now all of a sudden we kind of got this new information, and they're like, if you want to continue the trial drug, we are A-okay to do that. And so that really it shocked us, because we were like, man, we really thought we were done. But so yeah, it's definitely, it's a very big undertaking for the family to continue something like that. Like you said, we have been doing it for 3 years. It was very taxing on our family at times. But I don't have any regrets. So I guess we made a good decision with that. But yeah, I guess definitely going forward, if we ever had any clinical trials that came up or any new medications that doctors are recommending, we would 100% go through decision coaching to figure out our answer for that.
Are there any other questions from anyone else on the line that, or you can always contact me privately as well after this session if you'd like, or go through Defeat Duchenne if that's easier for you. But
Don't see anything else, Bonnie. No, nothing in the
okay.
chat.
There's a 2. Is that another question? Is it 2 or not there?
No, you don't see that.
Okay.
No.
All right. I think my slides are done, I think, and I thank Defeat Duchenne for their support.
Well, thank you, Bonnie, and a big thank you to everyone who took time out of their busy schedule to join us today. Sarah and Peter, thank you so much for coming forward and being willing to share your experiences. And I think that really, spoke volumes as far as the value that's offered through this program that Bonnie's put together. Bonnie, our decision coach, thank you. You've taken this concept to new heights, and your dedication and passion of the program's terrific. So it's always great to hear your enthusiasm for it and the passion that you bring to it. I want to just remind people of a few things that are going on as far as our organization is concerned, and some things that are broader. Tomorrow is Rare Disease Day. Affects over 3 million people across Canada. We're talking about Duchenne, but when we do that, we're talking about all rare diseases. I'll be at Queen's Park tomorrow morning for a breakfast with MPPs. We'll be hearing from some specialists. We'll be hearing a whole lot more about Rare Disease Day globally, of course. But for Canada, it's really critical that something starts to happen on a rare disease strategy, and soon. And that's the message that, on behalf of Defeat Duchenne Canada, we'll be taking to the MPPs tomorrow, and to also the physicians and clinicians that will be hosted as well. So it's an important morning with lots going on, but looking forward to it. And we have had so many discussions recently, as you've heard in the news. The federal budget that's been granted for healthcare, the increases that have come, the provinces that have signed on, and those who have not yet. But nevertheless, this is an opportunity and a window of opportunity to move the rare disease agenda along. Some of the other things we have coming up is our Walk to Defeat Duchenne on Sunday, May 28th. We invite any and all families and friends and neighbors to join that for sure. Another feature that we offer is Canadians Talk Duchenne. That's a monthly get together. The families and persons living with Duchenne share their stories, struggles, and provide an opportunity very informally for Q&A. It happens every month, and all the details are there on our website. We also offer for families our emergency care resources. What to do in the event of an emergency. We have a kit. We have details on what it is to do. Please contact our office, and we'll be happy to share that information with you and your families. Also, our clinical trial finder tool, something relatively new. It's available on our website. It deals with all of the ones on .gov, but also it deals with a Canadian flavor to them, and the types and locations and the clinics that are involved, and decisions around what we talked about earlier, Bonnie, in shared decision making. It asks some of the questions that you should be considering, and I think it's a very helpful tool when you take a look at what's involved in the clinical trials. The good news is Canada is getting on the radar more and more for clinical trials. And obviously that's been, for Duchenne in particular, the only way of getting treatments to the boys in Canada, which is something that we're continuing to work on as well.
Rick, I just want to say that I use that tool as a decision aid when
great.
when I'm working with families who are struggling. That's an excellent tool.
Great, glad to hear that. Again, I want to thank everybody, and a special thanks to our partners for helping us present the webinar series, to PTC Therapeutics, to Edgewise Therapeutics, Regenex Bio, to Atel Pharmaco, PepGen, Pfizer, Avidity Biosciences, and also to Roche. So I encourage you to get to know Defeat Duchenne Canada by checking out more on the things we talked about on our website at defeatduchenne.ca and signing up for our e-newsletter that goes out on a regular basis. Thanks to one and all, and have a great evening. Thank you for joining us.